Mechanical ventilation involves using a ventilator to assist or replace the patient's breathing. This may involve a machine called a ventilator, bag valve mask or BVM, which is compressed by a medical professional. The most common mechanical ventilators used apply positive pressure to the opening of the airway and air is forced into the lungs. The ventilator is a closed circuit that is attached to an endotracheal tube in the patient's airway. On inhalation, the oxygen-rich air moves from the ventilator to a heat-moisture exchanger, where the air is heated and humidified to simulate natural air. Air is then forced into the lungs, following the same route as that of normal breathing. On exhalation, carbon dioxide-rich air will be exhaled passively. With COVID-19 patients, it is important that pressure is always present on the lungs after exhaling to keep the alveoli open and assist with oxygenation to reduce breathing effort. Positive end expiratory pressure, or PEEP, is used in ventilators to keep this constant positive pressure. Mechanical ventilators constantly monitor the pressure, volume and flow of air. Medical professionals use the monitored variables to choose the best ventilator mode for the particular patient. Invasive mechanical ventilation involves an instrument placed through the mouth into the trachea, such as an endotracheal tube, whereas facial masks and nasal prongs are commonly used for non-invasive ventilation.